So for as long as I can remember, people in my family have had breathing problems such as sleep apnea and asthma, and I've always wanted to learn why those things happen and what I can do to help. So I soon decided to turn those thoughts into facts. Hi, my name's Mackenzie Gillespie, and today I'll be telling you about my desired field of work that I'm wanting to go into. I'll be giving you more information about the everyday life of a respiratory therapist. So taking a look into the live, let's begin with what they do on the daily. So respiratory therapist interviews and examines patients. So they'll come into the room, they'll ask them questions, what their symptoms are, what they think may have caused it, when did it start. They then report back to the doctor and tell them, kind of what's going on. And then once the doctor diagnoses the patient, of course, they'll probably be on a new breathing. Either, if you have asthma, you get the inhaler, or the sleep apnea, you get the mask to breathe in. And then after the doctor diagnoses them, it would be my job to then show them how their new machinery works. So the job demand for respiratory therapist has, of course, gone up during the pandemic because the first symptom of COVID-19 is not being able to breathe. So I'm going to tell you a little bit more about that. The outlook is projected to grow 19% within the next 10 years. And then depending on what kind of work environment you're working in is really going to determine the demand of the job. So nursing homes, of course, have a big demand for respiratory therapists, and hospitals. You can only have a few depending on what nursing home, so there's more of a job outlook in a hospital. For respiratory therapy, your salary can be between $59,000 a year to about $62,000 a year. And again, this will depend on the work environment you want to work in, your education level. If you just got your associates, your bachelor's, or your master's, of course, that's a big factor in what you're going to get paid. And of course, the job experience. If this is your first job, you're not going to get paid as much at first. But if you're very experienced and you have a good job experience in past jobs, of course, you're gonna have a better pay. So that is all I have for respiratory therapy. This was a look into a respiratory therapist live. It's been great informing you about what they do, the job outlook, and the pay salary for this job.